Good afternoon. Thank you all for being here today. Before we get started, a couple of things I just want to mention. One, just earlier today, we did a pinning ceremony of the Major General of the National Guard today, got promoted from a 1-star to a 2-star. And I thought, serving in the military, serving in law enforcement 22 years, how important that day that was for Missouri, and especially for the people at home listening today. How proud I am to have a 2-star general. Very few in the United States compared to the population all over and for Missouri. A gentleman that carries a Purple Heart, carries a Bronze Star, a soldier, but wasn't a lot of coverage of that today here at the office. But for the ones that were here, I appreciate them being here. But what a historical time for our state, and what a moment it was for General Compton and his family, and for our men and women that served the uniform. So I was honored to do that. I also, we lit the Capitol up this week for Alzheimer's Week. That's a kind of something that hits dear to my heart. My dad dealt with this for over 4 years before he passed away, and it was just brought back some good memories of my dad, but to recognize all the people that go through this and the families. I want to tell you, me and Teresa, our heart goes out to you, and our thoughts and prayers are with you as you fight this disease out there. It's great to be back in the Capitol. Teresa and I both returned to our regular schedules on Monday. We are glad to be back, and we thank everyone for their thoughts and prayers during that time. We are also thankful and blessed to be two of well over 100,000 people that have recovered from the COVID-19. We are also thankful that all my staff is back and healthy, and we continue to move forward and work hard for the people of Missouri. Before I get into COVID-19 updates for today, I'd like to start with an economic and budget update. When we evaluated the impact of COVID-19 on Missouri's economy and state revenues back in June, we had to make some difficult decisions to keep our budget balanced. Just like many of you Missouri families trying to budget and deal with the financial impacts of COVID-19, we took the same approach, cutting expenses where we had to. However, we promised to reevaluate our spending after the first quarter of the fiscal year 2021, and that is what we have done. When we made those conservative budget decisions, the projection was that Missouri's unemployment rate would be around 16.3. However, our current unemployment rate is actually 7%, less than half of what we originally projected, and lower than the United States average unemployment rate of 8.4. Additionally, just this week, we released our September General Revenue Report, which showed that the net general revenue collections for September 2020 increased 3% compared to September 2019, from $917 million last year to over $944 million this year. As a result of our Show Me Strong recovery plan, we are outpacing our budget forecast and recovering more jobs than the vast majority of other states. Thanks to this, we are now in a position to release some of the funding that was restricted earlier this year. Today, I am happy to announce over $133 million to support critical services in several areas, including nearly $95 million in CARES Act funding and more than $40 million in general revenue. Nearly $100 million of these funds will support K-12 and higher education. Specifically, because of the new spending guidelines, $61.5 million of CARES Act funding will go through K-12 education. These funds will be dispersed to school districts through DESIs similar to the foundation formula. $26 million in general revenue will go to higher education, as well as $10 million in CARES Act for private colleges and universities. The remainder of the CARES Act and general revenue funds will support several other areas, including assisted living and residential care facilities, child care providers, independent living centers, senior citizens and developmental disabled citizens, individuals suffering from substance abuse disorder, individuals experience barriers to enter the workforce, building on our infrastructure, and serving our military communities. These funds will also help ensure that those who receive government assistance actually qualify for that assistance, ensuring better accountability for taxpayer money. We are excited to be able to announce these funds today, and we will continue to evaluate our budget and spending as we move forward. Our workforce also continues to make a strong recovery. Of the historic 346,000 jobs lost due to COVID-19, we have now recovered over 200,000, 58% of those jobs in our state. Only 11 states in the United States have recovered more jobs than Missouri, putting us at 12th in the nation. Confidence in the economy is also growing. Missouri recently scored the highest in the nation in the Business Conditions Index, which measures employer confidence in the economy over the next 3 to 6 months. When employers are confident, they tend to hire more employees, which means more jobs for Missourians. This is also great news, and I encourage all Missourians to utilize our Show Me Recovery website as we continue to execute on our recovery plan. There is some great data and information here that shows the big picture of the overall recovery, not only on the economy, but also public health and social impact. I want to remind everyone that when we talk about COVID-19 cases, the number you often see reported is the total number of cases since March the 7th. That is a grand total that can be misleading because it does not include the number of people that have recovered. Out of the more than 134,000 positive cases in Missouri since March the 7th, the vast majority, over 100,000 people, have recovered or are currently recovering. This is why it is important to look at all of the data as a whole, not just pieces of it. Overall, our healthcare system is stable, and our fatality rate continues to show a downward trend, which we are also thankful for. Like I said last week, this fight is not over, but we are on the right track, and we have come a long way, and we will continue to improve with hard work, and we will push forward. As far as a vaccine plan, our multi-agency support team is finalizing our distribution plan, which will be released next week. We have been working on this plan since August, which focuses on 6 main areas designed around the CDC's COVID-19 vaccine playbook. And they are prioritizing regulation, coordination, technology, logistics, and engagement. Through these lines of effort, we have been communicating with local public health agencies on vaccine deployments. We believe we are ahead of most states in the planning process as it's time, and we will be well prepared for our citizens when a vaccine does become available. As I have said many times, it is a balancing act between COVID-19, the economy, schools, civil unrest, and the many other challenges facing our state right now, including violent crime. During the Post-Commission's meeting on June the 1st, I challenged the Commission to take a leading role in advancing and performing the training Missouri provides its officers and help them improve relationships with the public. On Monday, the Post Commission voted to require annual training in de-escalating techniques and recognizing implicit bias for all Missouri law enforcement officers. Beginning in 2022, Missouri officers will be trained in each area as part of their required 24 hours of annual continuing education training. I applaud the Commission for the following through on this challenge and carefully considering the issues faced by law enforcement today with the input from both Missouri citizens and law enforcement officers. Also, on Monday, the Post Commission voted unanimously to grant preliminary approval for Lincoln University's proposal to establish a law enforcement basic training academy. This proposed training academy would be the nation's first at a historically black college and university. Recruiting officers, especially minority officers, is a major challenge for law enforcement today and a major priority for my administration. This training academy could have far-reaching impacts in addressing this issue and recruiting more minorities to serve in law enforcement. The Missouri State Highway Patrol has also been working hard to address issues facing law enforcement and improving relationships with our citizens. The Patrol has recently hosted several accountability forums to give the public a hands-on look at Missouri State Highway Patrol policy regarding the use of force and training. These forums focus on the use of force options as well as the use of force policy and tracking. This forum also includes 2 practical hands-on sessions in which participants utilize a use of force training system and conduct simulated traffic stops with an actual patrol car, role players, and simulated weapons. This is a great opportunity to develop a better understanding of the Highway Patrol policy and training and open lines of communications between our state troopers and the members of the public. We look forward to attending this forum next week at the Highway Patrol General Headquarters here in Jefferson City. Also dealing with violent crime. In September, I signed House Bill 66 on the Witness Protection Fund and House Bill 46 on the St. Louis Police Residency into law. These bills are both a very valuable tool that will build on our efforts to combat violent crime, supported by law enforcement officers, and that make our communities safer. This was the #1 priority for all mayors, law enforcement, and the African American community. Last month, we held several ceremony signings of House Bill 66 with local law enforcement across the state. Tomorrow, we will be traveling to St. Louis for a ceremony signing of House Bill 46, which removes the residency requirements for public safety employees in the city of St. Louis. All of these things, law enforcement training, the Lincoln Training Academy, Highway Patrol forums, and these pieces of legislation are all great steps in the right direction for our state and our society. We are encouraged by this process, and we must continue working together to combat violent crime, support law enforcement, and make our communities safer. As always, I will end this with what I've been saying for over 7 months. Social distancing is the key. Wear a mask and wash your hands. And it is not one of 3, it is all 3. Social distancing, wear a mask, personal hygiene. These are still the most important steps we can take to combat COVID-19, and with flu season approaching, these steps are even more critical. We are making progress every day, and we must keep up our efforts. This virus and is going to be here for a while, but together we still will get through this. God bless, and thank you very much. I think also Dr. Williams is here today to take a few questions, make a couple of statements, so we'll bring him up.
Dr. Thank you, Governor, and thank y'all for being here today. I just want to first express my appreciation to you. About 2 weeks ago, we talked about how important the flu vaccination campaign is this year, and just read some excellent and saw some excellent stories in the media about that. So you have my sincere thank you for doing that, and hope that you'll continue doing that. I think it is a role of journalism really providing a public health service. So I want to thank you for that. I want to thank the governor. I got up early this morning and ran across the Missouri River, as I do every morning, and coming back, the purple of the dome was reflecting on the river. It was still, it was beautiful. And so that reminds me that even amidst COVID, we have 200,000 Missourians who have Alzheimer's, 5 million Americans. And so I hope people will join me this Sunday as we do a virtual walk. I usually do that in person, but this year we're doing it virtually to help raise money for that, and just greatly appreciate the governor lighting up the dome purple, because it raised my awareness this morning, and I always think that's good, especially in this time of COVID. Some things get pushed to the side, but for those families and those patients, that's not the case. I also want to thank the governor. We're going to be on a phone call shortly with all the local health departments who've really been the tip of the spear for all that we're doing and will continue doing with our flu campaign and COVID. And so very much appreciate him expressing his appreciation to all of those today. And finally, he was just thanking me and asking me how everybody's doing in the department at Health and Senior Services, and really our whole government approach. And I told him we're doing fine. People have really stepped up. They know the importance. They know this is time sensitive. But very much appreciate him asking about them, and just would pass along from them just how important, how much they appreciate the people who appreciate what they're doing. So with that, Kelly, I'm happy to answer any questions.
Any questions for Dr. Williams? Philip?
Hi, Dr. Williams.
Hey, Philip.
In terms of flu vaccination progress, do you know off the top of your head how many people have been vaccinated up to date compared to date last year?
It's a great question, Philip. I don't know the answer. If I can find that out, I'd love to share that with you. We're early, but that's a great question, so thank you.
And then on COVID, in terms of people who have recovered, are you at all tracking people's condition as they recover, if they have long-term lung damage or inflammatory problems or anything like that?
Yeah, as we've talked about before, no matter where you see that data, estimates, it's an estimate of how many people have recovered. Now, sometimes in a very small cohort, you can actually call people and track. You've seen probably the reports of people who have longer symptoms. We don't think that's a majority by any means. It's a minority. But I think those studies will be ongoing to see how many people continue to have, for instance, muscle aches or vertigo or fatigue. We'll continue to watch that. I think it's any data now would be very preliminary, because we really think you'd have to have some longevity to look at that.
Dr. Williams, since the COVID dashboard launched back when the pandemic really first started, the state has never released numbers on recoveries. It's only been the total of cases and the total number of deaths. Is the state changing their approach to this? Is this going to be something that's updated regularly, or is it just going to be something where we continue to have to subtract deaths from total numbers of cases to say, oh, X amount of people have recovered?
Well, when you talk about recovery, I think you're thinking that if you had 100 people, how many end up in the hospital, how many, obviously you mentioned fatalities, and we know that number. But when you talk about long-term complete recovery, I think that was the question, that we were just addressing. The number that's in the literature is that 80% of people will recover, such that they coming out do not have any ongoing issues. And so I sometimes see that number out there as if it is a data-driven and it's more of an estimate. But I think it does underline the fact that, thankfully, especially when you look at the different age groups, the vast majority of people who get COVID do recover. But as I've said before, even though I've said that statement, we do not want any one person to get COVID in Missouri, period.
So again, is the state going to be posting these numbers for recoveries then? Because currently that number is not available.
Well, it would just be an estimate. We don't have one that we literally follow up with people and say, have you completely recovered? Are you having any symptoms or that type of data? And again, for 100,000 people, we probably just wouldn't be able to do that. And I don't know of anybody who's doing that on an aggregate fashion in the United States. Although I'll look on other states' dashboards, I do it frequently, and it'll say the number of recovered, but they are estimating there, which is fine. It's a reasonable thing based on science, but just don't believe that's an actual number of proven recovery. Does that make sense? Thank you.
I thank you, Dr. Williams.
Okay, thank you, Kelly.
Governor Parson will take a few questions.
Hey, Governor, were you surprised by the president's decision to stop talks about the federal stimulus package? And with that apparently not happening, what does that do for Missouri and its recovery?
First of all, I don't know the conversation in Washington, D.C. I got plenty on my plate being the governor of the state of Missouri.
Governor Parson, previously you said that you would likely pardon the McCloskeys if they were given any sort of charges or if they were actually proven guilty. Yesterday they were indicted. What is your response to that? Are you still thinking that you might pardon them?
Most certainly would. Most certainly would. We'll let it play out and see how this all comes out in the courts, but I stand by what I said.
Hi, Governor. Yesterday there was an announcement that 4 of your staffers had tested positive for COVID-19. Did that happen before or after you and the First Lady received your positive diagnoses? And what sorts of measures are being taken here at your office, at the governor's mansion, to kind of prevent the spread?
Yeah, I'm going to refer to Kelly a little bit on this because I think there's 60 some odd between you take the mansion, the security detail, and some of them. Some were tested the same time me and the First Lady were, especially the people around us. But again, part of the reason this is all the employees, me and the First Lady, I know we're open to public scrutiny, to what people say. But these people have private lives here that work in here too. And the good news is the ones that have tested are all back to work, and we're doing fine here at the governor's office.
Governor, you've mentioned before there could be a supplemental budget special session. Given the news out of Washington and also the budget news you said today, does that change your timeline or expectation at all?
I didn't hear the first part of that, and what were you? I'm sorry, whoever said.
Could there still be a special session on a supplemental budget, given the news out of Washington and that you announced today?
Yeah, most certainly. I mean, that possibility is always there, and I would assume that will happen. Of course, there's still a lot of unknowns. I don't know what they're going to do in Washington, D.C., but we may very well do that just to make sure that we're prepared in case they do between now and the first of the year. Because if they do pass a second portion of the CARES Act or something, we want to be prepared to accept the money. We don't want to lose out on it just simply because we didn't make it. So we're looking at that right now. We're talking to the legislators, but we've got a pretty good plan in place for when that day happens. But yes, I would say there'll be a special session to a supplemental budget. I believe that will probably happen.
Governor, you said during the first part of your news briefing today that the total number of cases of COVID is misleading, and then you gave us the figure of over 100,000 recovering. I just asked Dr. Randall Williams about this, but is that something that you want to see on the COVID dashboard? Because that has not been given to us at all.
No doubt. I wish we had the data to do that, but we don't have the recovery rates in every county. But if you look at the percentage of 100,000, all the other numbers we use, whether it's CDC guidelines or anything, we never talk about the recovery rate. You can go there and look and see the percentage of people that are in the hospital in the state of Missouri, and you can figure out what that percentage is, and you can figure out who's out there. And there's a way you can do that. You might not get the exact number, but you're sure going to be able to get a good estimate of how many people's recovered. And I truly believe well over 100,000 people have recovered from the virus. That doesn't mean the underlying conditions are not still there, which is another thing that's very misleading. Because if you have other diseases, those could still be there. So I don't think without any doubt, well over 100,000 people have recovered from this virus in this state.
All right, thank you, Governor.
All right, thank you. Thank you very much.